A mysterious pneumonia has gripped China, with scores hospitalized by the illness.
Chinese authorities say they're investigating a viral pneumonia outbreak, and there's speculation that it could be linked to a SARS virus that killed hundreds of people in 2003.
It was March 11, 2020 when the World Health Organization made an assessment that COVID-19 can be characterized as a pandemic. Just 5 days later, on March 16, 2020, President Rodrigo Duterte declared a state of calamity in the country for the next 6 months and announced an enhanced community quarantine in the entire Luzon that would fully change the way we live.
Of Luzon under quarantine.
4 months later, at the heart of Central Luzon, the Medical City Clerk has been continuously serving every patient, including those who have been afflicted by COVID-19 and leading them to recovery. TMCC has maintained itself a safe zone for all patients, and today, we're going to know how they do it. Hello everyone, and welcome to Into the New Normal by the Medical City Clerk. I'm Ariane Nunez, and in this episode, 3 experts from the Medical City Clerk will be joining us to give some insights and shed the light on how they make TMCC a safe zone for all patients. So without further ado, set the volume to a maximum, get your notes and popcorn as you dive into the new normal. At this point, let's get to know the protocol and changes the Medical City Clerk has gone through and how they stayed ready in the battle against COVID-19. Let's hear it from the Medical Director herself, Dr. Jacqueline Angeles.
Dr. Jack, what are the general protocols that we should know?
Okay, for our hospital, the Medical City Clerk, we started actually preparing for the COVID pandemics last January. So we created a team, we call that a COVID Task Force, last January 24. This is a group of individuals from different departments of the hospital, including doctors and the different managers from all the different departments. This is a group which creates protocols and guidelines which will guide the hospital in taking care of the patients and in doing our services in line with the protocols of DOH and WHO and all the other guidelines from different specialties, medical specialties. So we will be prepared with the updates. Every once in a while we have meetings during Mondays, and then we tackle the different changes in the hospital in terms of how to take care of patients and also our doctors. So we created, it is actually pegged in 5 pillars. So which starts with, first, we have the disinfection or the infection control system. It is actually pegged from the guidelines of DOH and WHO in terms of course, hand washing, the importance of having the disinfection units in the hospital, our alcohols which are placed in the different areas of the hospital. And then we also have the screening mechanism. It's composed of nurses, which takes care of patients who come in for OPD purposes into different centers. And we also have a triage system in the emergency room. These are for patients who come in, and then they will be triaged into 2 areas again, whether it is patients who come in for emergency reasons for COVID symptoms and of course non-COVID symptoms. We also have a specific area in the emergency room for direct admissions and also for immunocompromised patients and for patients who come in for hemodialysis. And then aside from that, we also have a system of the mask, where patients cannot come in the hospital without the mask. And of course, very important, this physical distancing of 2 meters. So it's also practiced even before coming in the hospital. We created markers in the lobby, in the facade, before they go into the risk assessment area. And then when they go in the hospital, the elevators have markers. The patients in the waiting area in the OPD, the seats have markers. So it's very much imposed in the hospital. And also very importantly, the 5th pillar is the culture. Culture is like the general attitude of the patients and also the different staff in the hospital, where we cohorted the patients. We have clustered them in areas where patients will be admitted. There is a clean area or the non-COVID areas, and we also have a ward, which is we call the COVID ward, and also a gray zone, which is an area where patients who come in for emergency surgeries that didn't have the COVID rapid testing or the PCR test, the swab test, as we know. And then these are also for OB patients who come in without the PCR test. So this is like an interim area where we don't know yet if they have COVID or not. So afterwards, after the surgery, they get the PCR test done. Then we will be able to qualify them if they will go to the area of non-COVID or COVID area. So also the nurses and the team that is assigned for these patients are also separated. So there's a different team for patients who have COVID and different team for patients who are non-COVID. So the whole system is actually what we call as a one hospital in two system, which means that it's one hospital, it's the Medical City Clark, but we have two systems in play where we are able to cater or give services to patients who are non-COVID, but we are also able to take care of patients who are COVID. And of course, the patients who are non-COVID will be taken care of without being contaminated or without being infected.
Okay, that's so nice to hear, Doc. Now, we all heard that the basic protocols are being held here and practiced here. So that's so good to hear. Now, Doc, because everyone is hesitant to go out and we're not allowed to talking with everyone all the time, can you talk about the online consultation and how is that process?
Okay, it's very nice because this is one part of new normal policies or new normal programs that we have in TMC Clark, where we have what we call is the telemedicine service. This is like in the new normal, patients who wouldn't want to go to hospital because they're a little bit anxious or at least fearful, they can just call and avail of the services of the hospital for consultations online, because we have a pool of doctors who are actually specialists and who are board certified, who can actually talk to them and take care of them while they're at home. So this is what we call the telemedicine service. They can just call our hotline and they can have themselves have a schedule and their problems will be taken care of.
Oh, that's very good to hear. Now next, Doc, what are the procedures under TMCC on Wheels?
Oh, this is a very nice program of TMC Clark where the laboratory is actually, instead of you going to the hospital, the laboratory will go to you. So we call that laboratory on wheels, where not just the laboratory, actually, we can also provide pharmacy services if you have medicines that you need, and also diagnostic procedures like for rapid testing, we can do that, and also for x-ray. So if you guys need laboratory procedures or diagnostic procedures, you can just call TMC and our laboratories will go to you.
Who mainly avails this service?
There are a lot of actually cohorted patients. Some of the patients we get are patients who are actually with problems in ambulatory, patients who are post-stroke, they wouldn't want to go to the hospital. We have had cases of that. And the elderly patients, the immunocompromised patients, or pediatric patients. And sometimes we get patients who are actually families. Like the whole group, the whole bunch in the family would not necessarily go to the hospital anymore, but all the services they need will be given to them at the comfort of their home because of the laboratory on wheels of TMC Clark.
Okay, so you heard that, everyone. If you're very hesitant to go out, they have the TMC on wheels, so you don't have to worry about going outside. Now next, how can we access the result online and how secure are they?
Okay, so we're just very glad that TMC Clark is actually have a very good IT system. The results of patients for laboratories and diagnostics can be seen online. The patients will be given a reference number and then they can just key in. They have their own password, so it's very much secured. And then you can just view it. So it involves the laboratory tests that they have had in the hospital, and also for diagnostic tests like the x-rays and CT scan.
Okay, now thank you so much. Now for my last question, what are the payment banks or centers where patients can transfer their payment?
So there are actually two programs present in the hospital in terms of the contactless payment. Number one is for the OPD clinics. I have already talked with PayMaya. So this is for payments of patients who have PayMaya system, and then they can pay the doctors for the consultation fee without giving cash. So that's one in the OPD clinics. Number two is if you're inpatient or other patients who would want to pay online before the procedure, or if you're inpatient, you wouldn't want to give cash, you would want to pay online. We have had arrangements or collaboration with the banks, different banks or different credit cards, and they can actually pay their bills or their services online.
Okay, thank you so much. Now everyone, if you're very hesitant to go out, everything has been conveniently prepared to you by the TMC. So Thank you so much.
Thank you. And I would like to invite everyone to go in the Medical City Clark because we would like to assure you that Medical City Clark is always a safe zone for you. From the start of the COVID pandemic, we have been ready to take care of you and all your needs. And just go and visit us and avail of our services, both for inpatient and outpatient, because TMC Clark is a safe zone for you.
Thank you so much.
Thank you.
As the new normal brings us changes in the way we take care of our health, the Medical City Clark has maintained the hospital as a safe zone for all patients with the new normal protocols implemented to keep everyone safe. To discuss these safety protocols further, let's welcome the Manager of Quality and Safety Department, Ms. Raechelle Angeles.
Hi.
Can you talk about the safety protocols?
Yeah, so basically we have the general protocols following the new normal. So we call this new normal protocols. Basically we have this whole manual of new normal protocols. It's actually divided into two. It's the general protocols and the specific protocols. So for general protocols, no face mask, no entry policy. Then we have a stringent protocol in triaging and screening. So we have a separate entrance for the employees and for the patients and visitors. So wherein we screen and assess everyone who is entering the facility. So for example, if you have any of the symptoms related to COVID-19, then you have to go to the ER for more stringent triaging and assessment. And then we also have this, of course, the social distancing and the physical distancing, rational use of PPE. So for every area, we have these specific PPEs to be used. And then what's good about TMC is we have these specific protocols. For example, if you are in the surgery department, you have more stringent protocols in terms of surgery. And then, for example, if you are in a dental department, so you'll have another protocol for dental department. So basically, it's a whole wide protocols for every unit and for the whole TMC community.
Okay, so Ms. Raechelle, what if they fail at the triaging and assessment? How is the process of that?
Yeah. So you mean when they fail in the triaging at main lobby or staff entrance, basically they have to go to the ER for another assessment. So at the ER, we have our nurses and our ER consultants and doctors who will assess them and who will give the clearance whether if they are COVID suspect or probable case.
Okay, that's so good to hear. Now, everyone, if you are planning to visit TMC Clark, rest assured that everything is safe because of the safety protocols that is being held here. You can just stay at home if possible.
So yeah, in addition to that, basically when we have this COVID-19 struck the whole world, we have this simple message of stay at home. But this made a ripple effect to everybody, especially those who needs more medical attention or those who needs to go to the hospital. So we need to change this message a little bit. Instead of staying at home, we need to keep in mind that do not delay your health.
Yes,
We in TMC Clark are ready and we have all the safeguards and the readiness to protect everyone who would enter the TMC community and the Medical City Clark facility. So again, do not delay your health.
Yes, if it is very necessary, you have to go
Correct.
to the hospital and have yourself checked. Okay, thank you for that, Ms. Raechelle. Now, one of the things that we should always remember is do
Wear
not
your
delay your health, always wear your mask, and wash your hands.
Yes.
Thank you so much.
Thank you.
If you enter the premises of the Medical City Clark, you might notice some new things inside, like the stickers and signages placed at every corner and their physical rearrangement. Let us know what preparations TMCC has prepared to ensure the safety of every partner, from the manager of the General Service Department, Engineer Michael John Lacanlale.
Hi, Ariane.
Sir, thank you for being here today. Now, for my question, what are the preparations done here at the Medical City Clark?
So to prepare with, we have different entrances and exits for our staffs, healthcare workers, patients. We also have the emergency department as entrances for those people assessed as probable and suspect COVID-19 cases. So we have placed markers, especially on our elevators, which we limit the number of passengers that are using it on a given time. We place markers on every areas that we have in Medical City. plastic barriers. This is to give protection also to our staffs and patients who are visiting the hospital. We also made acrylic barriers to help our healthcare workers protect themselves while doing the examinations, like for ultrasounds and other consultation or diagnostic procedures. Also implemented a more frequent disinfection and housekeeping protocols, especially on those areas that are frequently being used by our patients and healthcare workers. These are for example, the handles, the doorknobs, the surfaces. We added also the UVGI or the ultraviolet germicidal irradiation. This is to expose these areas into ultraviolet light C. This is to kill and inactivate those microorganisms. For electronics naman, what we did is we placed a wipeable plastic cover which is being disinfected by our housekeepers from time to time, and then it is replaced every day.
Sir Lacanlale, as you mentioned earlier, these markers are also color-coded, right?
Yes.
So what are the purposes of that, and what's the meaning behind the colors of those things?
Well, for the purpose of these color-coded areas, or what we call the zoning, is to identify what level of PPE that we will use in going on this area. For example, the green areas or the low-risk areas, the minimum PPE requirement is face mask, alcohol, and hand disinfection. We have also yellow areas, which is also considered a low-risk area, but the minimum PPE requirement here is face mask and face shield. For orange areas, these are areas that where we do diagnostic and consultation procedures. The minimum PPE requirement here is surgical mask, face shields, and some protective clothing. For gray areas, these are areas wherein we are placing patients that are still awaiting for their PCR results. So the minimum requirement here is also protective clothing, surgical mask, and face shields. The last area, which is the high-risk area, is the red zone, wherein this area specifically handles those probable and suspect COVID-19 patients. These are specifically our COVID wing and the ICU rooms and the emergency department.
Okay, so you don't have to worry about suspects because everyone is being well distributed in their areas.
Yes.
Right? So how about the negative pressure isolation? Can you talk about that?
Well, for negative pressure isolation rooms, these rooms have simply lower pressure than the pressure outside. This creates a vacuum effect to make sure that the air inside the room doesn't escape the room itself and to its adjacent corridors. This protects everybody outside from the patient being confined inside the room. Then the air goes directly outside through a series of HEPA filters before being exhausted outside to make sure that even the air outside is being filtered and no air is being recirculated inside the hospital.
Thank you for that information, Engineer Lacanlale. Now, if you are to visit TMC Clark, rest assured that the safety protocol is already in place. But in addition to that, the safety and maintenance is also okay thanks to Engineer Lacanlale. Thank you so much, sir.
Thank you. And also being guided by the international and Philippine standards as provided by CDC, WHO, DOH, and IATF. All preparations are being done in TMC Clark to protect everybody else and to stay ready during this pandemic. Thank you.
And that's it for
for today. We would like again to thank our guest speakers for feeding us the information that we need that could help us prepare for this new normal. Now, if you have the time, please don't forget to visit our official website. That's www.themedicalcityclark.com, and visit our official Facebook page. That's also www.facebook.com/themedicalcityclark, and follow us on Instagram. That's at themedicalcityclark. And of course, don't forget to like this video and message us for more details. Again, please stay safe. Don't forget to wash your hands. And again, this is Ariane Nunez here at the Medical City Clark, where patients are partners.